My name is Dr. Nader Hawa, and I'm a general practitioner. And my focus in my general practice is on full mouth rehabilitation cases and cosmetic stuff. When I was little, my mom had been diagnosed with juvenile periodontitis. And of course, at the time, I didn't know what it was, but it's a genetic form of gum disease. So lots of bone loss involved, lots of bleeding gums, and poor thing. I mean, for somebody with excellent hygiene, to suffer from all of this, it kind of always kept me wondering, why is she always at the dentist's office? And I used to go with her back in the days when dentistry was completely different, of course. And the dentist happened to be my dad's friend. And he used to come over to the house when she had emergencies and she couldn't make it. So I remember him looking at her teeth underneath the kitchen light and trying to figure out what's going on. And that just stayed in my mind whenever I was growing, and I ended up in college. I started out as a pre-medical student. Dentistry was one of the things that I really wanted to pursue, and I kept medicine in general as one of the things. But once I finished my pre-med and I looked at everything else involved with dentistry, I just decided to go forth to pursue that as a career. There's a lot of benefits to being a dentist, but one of them is really trying to make a difference in people's lives. That's what it's all about. It's caring for people, changing their entire life by making them healthier. Well, just like any recent grad from dental school, you're always excited. You want to go out there and you want to do everything that you've learned, which is not really much. And you kind of realize that once you graduate. So that really prompted me to just enroll in as many continuing education courses as I could. And I've taken thousands. And I did that for a reason. Of course, not every single one of them was beneficial, but I didn't have anybody to direct me. I just wanted to take as many as I can and build up my clinical abilities to just be a better dentist, and offer more services to patients. Well, the most important thing for me, I want the patient to feel like they're at home. It doesn't matter what you're coming in for, from the simplest procedure of a sealant all the way up to major implant surgery, sinus lifts, and full mouth rehabilitation. We treat everybody the same. And so our patients, when they come in, I think they feel that. They feel like they're important as people, first of all. There's a lot to learn from life in general. Policies are set to make things better, but sometimes you gotta kind of eyeball things in life. And the best example I can give you is, if you recall that movie Sully, about the plane that crashed into the Hudson. The question that kept popping: why didn't you go back to LaGuardia? Why didn't you do this? Why didn't you do that? Why didn't you calculate? Well, there's a human factor involved in everything that we do in life, and nobody can teach you that. So the human interaction is very important for people to feel. It's important for you to feel that I, as a doctor, as a dentist, as whoever, I'm treating you as a fellow human being. And the calculations, the policies that are set are good to have in order to make things run smooth. But if somebody wants to come in and say, I don't want to fill out paperwork, I would like to meet the doctor first, I have a general question about Invisalign, about full mouth rehabilitation, about veneers, we can answer that, and then if you decide to move forward, we'll do that.